In just 72 hours without alcohol, your body begins a transformation so dramatic it shows up on medical blood work. I'm Dr. Ngundi, and after spending many years in medical school and working with hundreds of people struggling with alcohol related health issues, I'm going to show you exactly what happens to your body week by week when you stop drinking. And here is what shocked me the most as a doctor. The changes start faster than you think, and they are measurable. We are talking liver enzyme, brain volume, cancer risk markers, all shifting within days to weeks. Whether you're a social drinker or someone who's been hitting in harder than you like to admit, your body has an incredible capacity to heal itself. So let's break down this timeline because understanding what is happening inside your body might just be the motivation you need. Day 1 to day 3, the withdrawal window. Let's be honest. The first 48 to 72 hours can be rough. You might experience headaches, anxiety, irritability, and even tremors if you've been drinking heavily. This is simply your nervous system recalibrating. Alcohol is a depressant that your brain has adapted to, and now it's screaming for balance. But here is the good news. Your liver is already celebrating because within 24 hours, your liver enzymes, especially ALT and AST, begin dropping. These are the markers that are checked in blood work to assess liver damage. Day 3 to day 5 is the sleep architecture restoration. You might think alcohol helps you sleep. That is a lie your brain tells you. Alcohol suppresses REM sleep, the restorative phase where memory consolidation and emotional processing happen. By night 3 to 5 without alcohol, you will experience what we call REM rebound. You might have incredibly vivid dreams, even nightmares, as your brain catches up on all that lost REM sleep. This is actually a good sign, showing that your sleep architecture is healing. Day 5 to day 7, hydration revolution. Here is something most people don't realize. Alcohol suppresses ADH, antidiuretic hormone, which is why we pee constantly when drinking. By day 5 to day 7, your ADH level normalizes, your kidney function optimized, and your cell finally get properly hydrated. You will notice clearer eyes, less puffiness, better skin texture. Your body is literally hydrating from the cellular level up. By the end of week 1, if we ran your blood work, we'll see ALT and AST enzyme dropping by 30 to 40% in most cases, sign that your liver is already regenerating. Week 2, the mental fog lift. This is where patients usually feel like they've woken up. Around day 10 to 14, neurotransmitters like dopamine and serotonin start stabilizing because alcohol disrupts these chemical messengers, leaving you in a fog of anxiety and low mood. I once had a patient back in 2019 before the pandemic, let's call him Patrick, who told me at his second week checkup, "Doc, I didn't realize how much mental energy I was wasting just getting through the day." His executive function, decision making, and focus all improving because his prefrontal cortex was finally operating without a neurotoxin. Week 2 to week 3, the weight loss math. Let's talk numbers here. A moderate drinker consuming 3 to 4 drinks per night is taking roughly 1,000 extra calories daily. That is 7,000 calories per week of pure nutritionally empty alcohol. 7,000 calories equal to 2 pounds of fat per week. By week 3, without changing anything about your diet or exercise, you could be down 4 to 6 pounds just from eliminating alcohol. Plus, alcohol spikes insulin and promotes fat storage, especially around your mid-session. Week 3, this is skin transformation. Your skin is your largest organ and it's been suffering. You must know that alcohol causes systemic inflammation, dilates blood vessels, halo readiness, and broken capillaries. Moreover, alcohol dehydrates skin cells. By week 3, patients constantly report reduced readiness and puffiness, fewer breakouts because alcohol disrupts bacteria which affect skin. Natural glow returning as circulation improves. Fine lines softening from proper hydration are being noticed. Medical studies show inflammation markers like C-reactive protein drop by about 25% after 3 weeks of abstinence. Week 4, the Bloodwork revolution. If we ran comprehensive labs at the 4-week mark, here is what we'd see. Concerning your blood pressure, systolic pressure drops by 3 to 6.4 millimeter mercury and diastolic by 2 to 4 millimeter mercury. That might not sound dramatic, but in cardiology, every point matters for heart attack and stroke. Insulin resistance. This one shocked me when I first saw the research. After just 1 month of abstinence, insulin resistance decreases by 25% independent of diet or exercise changes. Your cells become more responsive to insulin, reducing diabetes risk. Liver regeneration. Your liver is one of the only organs that can fully regenerate. From mild to moderate alcohol-related damage, we see AST and ALT enzyme return to normal or near normal by week 4. For more severe damage, full regeneration can take 2 to 6 months. Month 2 to 6, the brain rebuilds itself. Here is something incredible. Brain imaging study shows that within 14 days to 1 month of abstinence, brain volume increases and ventricle size decreases, because alcohol literally shrinks your brain. And the most amazing thing is that your brain can actually reverse this. We will notice that cognitive improvement, memory, executive function, and processing speed become measurable within 1 to 6 months. Here is the good one. Cancer risk reduction. Alcohol is a group 1 carcinogen, same category as tobacco or asbestos. It's linked to 7 types of cancer: mouth, throat, esophagus, liver, colon, rectum, and even breast. A study showed cancer risk reduces by 4 to 9% depending on your previous drinking levels, with benefit detectable within months to years of abstinence. Cancer-related growth factors in your blood begins declining within weeks. Your immune system starts strengthening. You must know that alcohol suppresses your immune system. After several months of abstinence, inflammation markers drop, white blood cells function improves, and your body's ability to fight infections and disease strengthens significantly. Have you ever noticed that whenever someone is an alcoholic is more susceptible to getting sick? That is because alcohol weakens your immune system. Okay, here is the question everyone asks. Doc, do I need to quit completely or can I just cut back? Let me tell you this. If you are a light to moderate drinker, like you're taking 1 drink per day for women and 2 drinks for men, and you have no family history of addiction, no liver disease, or no mental health issue exacerbated by alcohol, moderation might work for you, because some studies suggest light red wine consumption might have cardiovascular benefits, though the research is increasingly controversial. But here is my honest medical opinion. There is no safe level of alcohol consumption when it comes to cancer risks. The World Health Organization has made it clear every drink increases cancer risk incrementally. Plus, moderation is the slippery slope. If you've struggled with controlling your drinking in the past, if alcohol has caused problems in your relationship, work, or health, elimination is the only evidence-based answer here. Here is my recommendation framework. Ask yourself the following questions. Can I constantly stop at 1 to 2 drinks without wanting more? Do I use alcohol to cope with stress, anxiety, or emotional pain? Has alcohol negatively impacted my health, relationship, or responsibilities? If you answer no to 1 or yes to 2 or 3, elimination is your path. Now that we are at the end of this video, let's ramp it up. Your body is an incredible healing machine. Whether you choose moderation or elimination, the changes we've discussed today are real. They are measurable and they are waiting for you. If you found this valuable, subscribe for more evidence-based health content. And if you're struggling with alcohol, please reach out for a healthcare provider. You don't need to do this alone. And for some of you out there who have won the battle against alcohol, please drop in the comment section. What surprised you the most about the 72-hour timeline? Drop your biggest takeaway below. And if you've quit drinking, tell us what physical changes you've noticed in the first week. I'm Dr. Ngundi. Thanks for watching, and I'll see you on the next video.